So, what's a long term adaptation to long term stress, whether it be physical, chemical, or mental? Remember, when you're under fight or flight, the body is going to release a lot of cortisol. So, cortisol's main function is to try to mobilize blood sugars, especially. And that's why when you see women and they have long term infection or they just have way too much stress and whatnot, and the adrenal glands can get very tired and they can get very fatigued. They're not going to respond in the same way, as a result. And this is why you have a woman, if she's very low cortisol, her energy is absolutely going to tank. And you know what? At that point, fasting is just completely contraindicated. But there's going to be a long term adaptation on the cardiovascular system. And here's what happens. Number one, you're going to have chronically elevated blood sugars. Elevated blood sugars will absolutely damage not only the cardiovascular system, but basically all of your soft tissues, which is why you'll see changes in the skin, changes in kidney function, changes in the endothelial lining around the actual arteries, and this includes the arteries around the heart. You'll also have chronically elevated high blood pressure as well. And can you also have elevated cholesterol, LDL? The answer is yes, absolutely. And that's why we always say cholesterol is produced by the liver based on demand. If you have a higher demand, if you look at this sex hormone pathway, if you have a higher demand for cortisol because of stress, it needs to come from cholesterol because that's the backbone of how it's actually produced. So, can your cholesterol elevate under high amounts of stress? Yes, it's the body doing exactly what it's supposed to do.